today I want to share with you what it's like being an ICU nurse in this current pandemic and my experiences of looking after COVID patients, because it is 2021 and there are still people who refuse to wear masks, who are protesting against a lockdown, and as one of my patients' relatives said, a conspiracy theory, and I'm tired of it. So to give you a little bit of a background about myself, I have been working as an adult registered nurse in London for the past 3 years, and I've been working in an intensive care unit in a hospital in central London for about 16 months now. And before that I was working in a acute medical unit, so I've kind of always been in the acute care setting. To give you an idea of what the situation is like now compared to how it was in the beginning, let me take you back to March 2020, when this whole thing kind of started and when we realized how severe the situation was. Back in March, I remember our unit starting to prepare for admissions of COVID patients. We started getting people mask fit tested for FFP3 mask, and also planning the layout of how the unit was going to be to prevent cross-contamination between COVID patients and non-COVID patients. And back then, when this was all kind of getting set up, it felt surreal. Like, it didn't feel like it was gonna happen, because I would be reading it on the news and it seems like this was happening far away, like back in China when the outbreaks first started, and it didn't feel real, like it was gonna come to London. While the unit was setting up for COVID patients, I went on annual leave for 2 weeks, and that's when the cases in London started to rise and London actually went on lockdown. During my annual leave, I was reading about how cases in the UK were rising and how severe the situation was getting in the capital, and also how my unit was getting more and more COVID patients. But then again, at that time, it just didn't feel like it was really happening, because I was at home and I couldn't really see what was going on at work. And it wasn't until I got back to work when I realized that the situation was getting really bad. I remember my first day at work where I had to wear full PPE. I couldn't even tolerate wearing the mask for even 2 hours. Like, 2 hours would just tire me out so quickly. Compared to now, I can tolerate it for maybe like 3-4 hours, but back then it was just really tough working in this new environment where you have to wear new full PPE, and sometimes we'd be alone in the side room, because that's how our unit is built. We mainly have side rooms. Sometimes I would be in the side room for about 2-3 hours, and it would just be really tough asking people to get me things, or just trying to escalate things to doctors. I found it really hard, and I remember at one time I got home and I cried because how tough it was getting. I mean, this was only probably like my third shift, and I was already having this like breakdown because I wasn't used to this new environment. And as our unit started getting more and more COVID patients, eventually we had to expand our ICU capacity and start admitting patients into our recovery unit. And even though we were getting more COVID patients, we don't get more ICU nurses. So instead, we got surge nurses, who are nurses from other departments who are redeployed to come and help in intensive care. And they were such a great help for us, even just drawing up infusions, because these patients would be on so many infusions to sedate them, to paralyze them, control their blood pressure, like just different infusions. And then it came to a point where I was looking after 2 level 3 patients instead of 1, and in ICU you're strictly 1-to-1 nursing care for a patient because they're so sick. You need to give them that attention to detail. But because we just didn't have enough staff, because staff were getting sick and they were shielding, it got to the point where we had to look after 2 level 3 patients with a surge nurse to support us. And mind you, at that time when this was all happening, I had only been on ICU for 6 months. So I barely knew my shit, and I had to teach surge nurses basic ICU nursing care, and while also managing them at the same time. It was a tough situation, and also we had new starters who also needed support. So we were just juggling a lot of responsibilities, and you can tell that staff were like really frustrated and getting tired by the time it was already May, June time. And even though we stopped having COVID patients for a few months, we still had to wear PPE for aerosol generating procedures. And in the summer it was really hard because it was like really hot and our air conditioning stopped working. And one time I just left the side room of my patient in my scrubs, like drenched in sweat. It was really bad. And then there was also a time where we almost ran out of PPE. It was coming towards the end of the shift, and our like kind of floor coordinator, so our senior nurse who was overseeing the whole unit, was advising us that we may have to reuse our PPE gowns because there wasn't going to be enough gowns for the next staff coming on. And you don't want to be reusing your PPE, which is already contaminated with COVID. It's not ideal. Luckily, we managed to source some more gowns for the nurses who were coming on the next shift, and we didn't have to reuse our PPE gowns. So that was the situation back in the first wave, where everything was new for us and COVID hospital admissions were rising, and we just pushed for beds, and patients were really sick, and we didn't know how to look after these patients and also look after them in the safest way possible due to nursing staff shortages and medical team shortages as well. And now we're in January, and London is now in its 3rd wave of COVID rise, COVID peak. Last week we topped 60,000 cases of COVID in a day, which is double what it was in March. And the news has been talking about how it is worse than the first wave, and when they say that, it really is worse than the first wave. So at the moment, my ICU unit has extended its bed capacity again to accommodate more COVID patients, but as well as trauma and vascular patients, because I don't think they're stopping elective surgery just of yet compared to the first wave where they completely stopped elective surgery. So I think they're still doing some elective surgeries at the moment. And compared to the first wave where I only had one shift where I was looking after 2 level 3 patients, there has been 3 shifts already where I was looking after 2 level 3 patients, and it's not uncommon for nurses to be doing that right now. Almost every day there is a nurse looking after 2 level 3 patients, which is way more often than the first wave, and it just shows how bad the situation is. And also, these people who are being admitted onto ICU, they are younger people compared to the first wave where we were getting quite elderly patients in their 70s, 80s. People who are being admitted onto the unit are like in their 30s, 40s, 50s, and sometimes even 20s, and they're usually young and fit and healthy and with barely any past medical history. So if you think that this virus is not going to affect you because you're young and fit, this new variant, it can infect even young people, and young people can get really sick from it. And it's just so frustrating seeing people who are out on the streets or on public transport or going to the shops who are refusing to wear a mask and then complaining they can't breathe. Well, you know, at least you don't have to wear an FFP3 12 hours a day, and Also, if you're complaining of not being able to breathe, then you sure as heck don't want to get COVID, because that's when you really won't know how to breathe. There have been patients who have been admitted onto the unit needing high requirements of oxygen, not yet ventilated, just needing high requirements of oxygen, and they struggle even just like sitting at the edge of the bed, or getting from the bed to the chair is a lot of effort for them. So please just wear your mask and don't go out and socialize and meet in groups, because all the staff working under healthcare, all the doctors, nurses, like cleaners, domestic staff, porters, we are just so tired, emotionally, physically, mentally, but we still have to go and do our job every day. We're probably all still tired from the first wave, but here we are doing it all over again, and we want this pandemic to be over just as much as you guys, but it's not gonna go anywhere if you just keep mixing and not wearing your mask and doing hand hygiene. So please just wear your mask. Another thing is that we have limited the visitors who come into our unit. Usually we would allow visitors to come twice a day, in the afternoon and in the evening, but because of COVID we've restricted that, and it's only in the circumstances of patients who are dying do we allow visitors to come and see their relatives, which is really sad, because most of the time we have to facilitate video calls for the patient's relatives who are at home, and it's just heartbreaking for me. Like, imagine your mom, your dad, your uncle, your auntie, sister, brother, grandma, grandpa being in hospital in their sickest moments, and you only seeing them through video call. It's tough for the relatives. I remember one time I was looking after a really sick patient, and it didn't look like she was gonna survive for much longer, and the daughter wanted to do a video call, but she rang just before handover, so I didn't get to do it during my shift. So I asked the nurse who I was handing over to whether she could facilitate this video call. I don't know if she did, and the next day I found out that she died. I felt so emotional, and I almost cried thinking whether the daughter was able to video call her mum before her mum passed away. It's just those things that are so emotionally draining for us. And then we see people saying that this is all fake, that this is a conspiracy theory, that the government is lying, when us nurses see it every day, like patients so sick and dying almost every day as well. It's just we're tired, we're burnt out, and everyone at work just complains about how tired they are of this COVID situation, and we just want it to be over as well. And recently my hospital started rolling out the Pfizer vaccine, and I managed to get it last week. But to be honest, when it first came out, I was hesitant on getting it because I have food allergies, and I was reading about how nurses who had previous allergies has like semi-anaphylactic reaction. But luckily, when I went to get my vaccine, my vaccinator was able to speak to a doctor who specializes in pediatric allergy and immunology. And he said that according to the MHRA, as of December 13, food allergies was no longer a contraindication of getting the Pfizer vaccine. So I felt more assured, and I'm still alive. I didn't get too much of a side effect. I just had a really sore arm for like a day or so. I woke up with it being like really sore and really heavy. I couldn't like lift it up that much. And then I think I just like had a slight fever in the evening, but it went away with paracetamol. So that is how the situation is at the moment in hospital. When you hear in the news that hospitals are overflowing with COVID patients and the situation is worse than the first wave, it's not an exaggeration, it's actually what is happening. I had an Uber driver when I was going home from work, asked me, is the situation really as bad as it seems in the news? And I was like, yes, it really is. And I can understand that you probably won't be able to fully know how bad the situation is unless you go into the wards and to ICU and see for yourself how sick these patients are. But take our word for it, the situation is far worse than the first wave, and we're all tired and burnt out, and we want this to be over as much as you do. So please just wear your mask, and I hope you keep safe. If you have any questions, please just let me know in the comment section down below, and I'll try and answer them for you. And stay safe, everyone. Bye.